Vaccines are effective in reducing the amount of deaths and the severity of illness when a person is infected with SARS-CoV-2. But they are not absolutely 100% guarantee that a person won't get infected. That means that it's still necessary to use what we call the non-pharmaceutical interventions. And those include wearing of masks and social distancing. There are also lovely studies where they've investigated outbreaks in the United States where the person who had the disease transmitted it on to others. And what they showed is if either the infected person was wearing a mask or the contact was wearing a mask, there's a 5 times less likelihood of transmission. Singing tends to liberate more numbers of infectious particles because quite simply we're breathing more than we would normally and with greater force and vigor, and so the droplets are probably being dispelled further. So when we wear the mask, and if we do happen to be carrying COVID in our throats, even asymptomatically, and we're not aware of it, masks trap droplets on the mask itself, and very few particles are liberated out into the atmosphere. There's no reason why we can't practice our religious services safely. We can observe social distancing, we can make sure the venue is well ventilated, or preferably we're outside, and we can sing with masks on. If we're indoors in an environment that can be controlled by us, definitely need to open windows and make sure that there's good airflow. What good airflow does is essentially dilutes these particles and reduces the chances that I might breathe an infectious particle in. If we go to a shopping center, say, or a movie venue, the air conditioning system is responsible for the number of air changes per hour. A packed soccer stadium with every seat filled, even though it's outdoors, is not likely to be safe, because we know that the droplets fall in a radius around us, that people are shouting and screaming, there's lots of interchange of air movement. So the authorities are slowly releasing the restrictions on the number of people that are allowed at a soccer venue, say, and it would make sense to have a number of seats between people sitting and preferably even have adjacent rows empty. So stadiums shouldn't be full. One of the difficult things when we gather together is around eating. So it's easy to do a chicken dance and say hello and keep our distance. But what's less easy to navigate is what do we do when we eat, because we have to take our masks off. And so there, social distancing is the key. And also to make it a family practice or a gathering convention that when we finished eating, we'll put our masks back on.